necessary to protect the health, safety, and welfare of Middle Tennesseans in light of the COVID-19 pandemic. With that, we will proceed, and the first item on the agenda today is the approval of the previous meeting minutes. So you have the minutes from the February 17th, 2021
Move
meeting.
approval.
Okay. Motion to approve by Mayor Moore. I recognize that voice.
Ryle, second.
And a second by Mayor Ryle. Are there any corrections or changes requested? Seeing no one with any, I would ask that all in favor of approving the minutes, please say aye.
Aye.
Aye. Aye.
Thank you. Is there anyone opposed to approval of the minutes? Okay. Thank you all. The minutes are approved. We move on now to public comment. Time of the meeting, when anyone in the public that would like to comment may do so. We also do have the option for you to submit comments to comments@gnrc.org if you're not on the meeting and do wish to submit comments. Mr. Skipper, do you have anyone wishing to comment that you're aware of?
Do not see anybody in the chat at the moment.
I guess I could be watching the chat too.
Yeah, I see none, and hopefully you can hear my audio a little bit better now.
I can. Thank you very much. Okay, then we will close the time for public comment and move along to introduce our Finance Director, Ms. Gail Wilson, with the financial report.
Thank you, Mayor Brown. You should have all received a copy of the financial report in your meeting packet, and I'm just going to hit a few highlights for January. At the end of January, we had received payments equaling $4,816,605. We had expenditures totaling $7,313,598, and we had a balance of $3,158,997 in our bank accounts after we took out the TCAT advance. Our expenditures continue to be under budget, and this is because of reduction in travel, workshops, and conferences expenses due to COVID, and then also a little bit in the consultant line item.
Does anyone have any questions for Ms. Wilson? Okay, before we move along, I have some very sad news to share with this council board. Ms. Wilson, I don't know if you can come on camera or not, but I think everybody would love to see your smiling face, because that's one of the things that I will certainly remember about you as we say goodbye to you today. Y'all, this is Gail's last day with GNRC, but she's moving into a new role with the Commission on Aging and Disability Services. You have done a fabulous job here. You're always a bright light to encounter, both online, but certainly in person. I will be fortunate because I'll get to bump into you here around Sumner County, but we will certainly miss you at the council. And we appreciate your service and your leadership and all that you have done for the financial status of the organization. Remember our audit, folks, so that's awesome. Anything you want to say before you say leave us?
Thank you, Mayor Brown. It has been a pleasure to serve at GNRC. I've been here almost 14 years now, and it's really been a family to me. And it's very hard to say goodbye.
Well, you will definitely be missed, but you will be loved where you're going, I'm certain.
Thank you.
So, anyone have any questions for Ms. Wilson or anything? I guess we do need a motion to approve the financial report.
So moved.
More seconds and wants to make a comment.
Okay, we have a motion and a second, and I will open the floor for comments. Mayor Moore.
Well, I just wanted to thank Gail. I had the opportunity to work with her when I was president of the council, and what a great job she's done, and gotten us through some rough times, and just thank her so much and good luck in the next phase of her life and career.
Thank you so much.
And Mayor Kirkman says in the comments, Gail, we will miss you, Gail. So you will be missed by all of us. Okay, we have a motion and a second to approve the monthly financial report. Any further discussion? Seeing no one indicating that they wish to speak, I will ask that all in favor, please say aye.
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 Any opposition, please say no. Okay, the monthly financial report is approved. Moving now to introduce Mr. Michael Skipper, who is going to talk about the annual update to the area plan for programs on aging and disability services.
Thank you, Madam Chair. Good morning again, everybody. Michael Skipper with the Greater Nashville Regional Council. I'm going to be joined on stage here by Sarah Fowler, the Director of Aging and Disability Services for Gnrc here in a moment, but I wanted to set the table a little bit for the requested action. So today we are going to be asking for your endorsement of a federally required annual update to our 5-year area plan on aging and disability programs for the region. I have on the screen here a slide, hopefully you're seeing that puts in a nutshell what the area plan represents. But as I mentioned, it is a 5-year plan that essentially is a statement of work for how we're going to coordinate and deliver important services aimed at sustaining and improving quality of life for older adults across Middle Tennessee, particularly from funding made available through the Older Americans Act and some additional programs that are funded by the state government. So that's a look at sort of the area plan in a nutshell and its purpose. I want to talk a little bit more about the Older Americans Act, which is really the source of the requirement for the area plans that we put together every 5 years with the annual updates, and also the source of the revenue that is invested into our region and other regions of America to support services aimed at the needs of older adults. But the Older Americans Act, it dates back to 1965. This was landmark legislation that was passed in response to national concerns, which were growing at the time, about the lack of community social services for older persons across America. The Act established grants to states for community planning and social services, invested in research and the development of new programs and strategies to support older Americans, and provided personnel training in the field of aging to make sure that there was qualified and capable individuals who could deal with the unique needs of an aging population. Subsequent amendments to that act, the act has been reauthorized many times since 1965. Subsequent amendments to the act created a national network of area agencies on aging to help coordinate and deliver programming. I'm going to come back to the notion of area agencies here in a little bit and use that as the pivot to talking about what GNRC's role is in delivering on the requirements of the Older Americans Act. But first, let's look at some of the focus areas. There are really 5 main focus areas that Congress has set forth through the Act. Number 1 is to empower older Americans, their families, and other consumers to make informed decisions and to have easy access to health and long-term care options. Number 2, helping seniors remain in their own homes with a high quality of life as long as possible. Number 3, to empower older adults to stay active and healthy, which I think contributes to the second objective. Number 4, ensure that the rights of older people are protected and to prevent elder abuse, neglect, and exploitation. And then number 5, the Older Americans Act is seeking to maintain effective and responsive management of the programs which are investing in the services to accomplish focus areas 1 through 4. So there is a good amount of accountability that comes with the funding. And you'll see in our own programming the staff that we use to make sure that services are providing with the expectations of standard and quality that are set forth by the federal and state government. I mentioned earlier the subsequent amendments to the Older Americans Act created a network of area agencies on aging across America. In Tennessee, we've extended that portfolio to include a focus on disability. So in Tennessee, there are 9 area agencies on aging and disability. We are the area agency representing the 13 counties of the GNRC footprint, generally northern Middle Tennessee, and we work hand in glove with our primary federal agency and then the primary state agency. At the federal level, you have within the Department of Health and Human Services, the Administration for Community Living, which serves as the main focal point for federal investments into aging and disability services. They work through, at the state level, the Tennessee Commission on Aging and Disability, which is headed up by Jim Schulman, and a literal commission that is appointed by the governor. And so working at the regional level across the state of Tennessee directly with each of the 95 counties are these area agencies. I mentioned there are 9, and we represent the 13 county area of the Gnrc footprint. The ultimate role of ACL and TCAT is to provide funding, the guidance to spend that money in a way that accomplishes national and state goals, and oversight to ensure that the area agencies and its network of providers remain in compliance with the regulations and any expectations that are set forth by the policies and the contracts that govern the use of the money. Looking a little bit deeper into the Older Americans Act, if you were to read the Act, you would find there is a Title III of the Act that has created, continues to fund key program areas. The first 4 on this list are defined in Title III of the Act. And then within Title VII of the Act, we get into ombudsman and elder abuse issues with the program creation and the funding. Real quick though, I think, the aging and disability services that we provide across the region, and then the network of area agencies, and then just all the terminology that goes into this, I think is often can be very confusing to those on the outside. So I wanted to demystify a little bit the program areas within the Older Americans Act, as well as what that looks like on the ground level. And then before I turn it over to Sarah, I'm going to talk a little bit about what our specific job is to make sure this is coordinated and delivered. The 4 program areas in Title III of the Act are supportive services, nutrition services, disease prevention, and family caregiver support. And for each of these, we've provided you an example of what that would look like on the ground. So for supportive services, what we're really talking about there are information and education about the options that are available to older adults, their caregivers, and other consumers that are in need of the services made available through the Older Americans Act. But in the end, what we're really trying to do is to make sure people are aware of and can tap into in-home care services. So whether we're talking about sort of long-term care inside the home or homemaking, chore-related duties, but also transportation services is a key component of the supportive services, and probably the most visible element of service within the supportive services category of the Older Americans Act. Within our region, we contract, as an example, with the Mid-Cumberland HRA to provide transportation services to senior adults across Middle Tennessee, particularly outside of Davidson County. The next program area is nutrition services, and this is funding specifically to make sure that older adults aren't going hungry. This is typically delivered in 1 of 2 ways: a congregate group meal setting or via home delivered meals, often known as Meals on Wheels across the nation. Again, we contract a lot of this out to Mid-Cumberland HRA or Metro Social Services for the provision of the nutrition services. The third program area is disease prevention, and the idea of making sure that senior adults have good information that's evidence-based, and then the programming support to follow that helps them ensure they are able to continue to make healthy choices to try to prevent chronic illness or a rapid loss in quality of life. And a lot of the programming that we do in this disease prevention is administered through the senior center relationships that we have across the region. And then the fourth program area is family caregiver support, which is focused on education and support and respite for family members or informal caregivers that are helping an older adult within the household. Often these folks are overworked and have limited training to do this job. And so we've got, a program area that helps make sure that they feel qualified, but also that they're not getting worn out and mentally or physically exhausted from the process. Then I also mentioned in Title VII of the Older Americans Act, there's a focus on senior rights and the prevention of elder abuse and neglect. And so we've got some funding through Title VII that's aimed specifically at programs to achieve those goals. So that's a look at the primary program areas, just to demystify a little bit the work that we do on the Aging and Disability Services side from funding through the Older Americans Act. In terms of the revenue for fiscal year 2022, you're really looking nationally at about approaching $1.5 billion of federal investment from traditional sources of funding. So we're not even talking about the CARES Act or of other COVID relief responses and supplemental appropriations, but it's about $1.5 billion nationally to invest in these program areas. And then you can see there by program area, the distribution to Tennessee and then GNRC's share for Northern Middle Tennessee. The largest category in terms of funding is going to be that nutrition services category. A lot of money going out to make sure that senior adults are not going hungry across the region. The area plan itself is really the primary way that we communicate exactly how we plan to coordinate and implement the levels of funding through these programs across our region. And this is something, like I mentioned earlier, is updated annually. The area plan also encompasses some very specific programs that were created and funded by the state as an extension of the Older Americans Act. One is the state does put aside money to extend the value of the federal investments in the programs that I just mentioned. So there is a set aside of state money that goes to reinforce nutrition, supportive services, and some of the things I just mentioned. But in addition, there is a public guardianship program that is created through the Tennessee Code that is funded primarily through the state government. We'll get into some of this a little bit later on, but there is a cost share there with GNRC to make sure that the court appointed clients to our guardians are taken care of. So the state options program, I should say, is sort of an extension of the OAA programs. It's really more focused on the in-home services, but you can see there's not inconsequential amounts of money from the state government going to support older adult services across Tennessee. In terms of eligibility and prioritization, and this is a generalization, you will find from time to time a little bit of exception in these rules, but the funding and the programs and services are largely aimed at older adults 60 years of age or older, and generally any older adult that is within that age category would be eligible. But we do seek to prioritize the limited funding that we have for services according to the list of characteristics that you see on the screen there: low income, ethnic, racial minorities, limited English proficiency. We try to prioritize folks that are living in rural areas and a bit isolated from family, friends, and services, and then so on and so forth. So this is a constant sort of reevaluation at how we're administering the services based on the unique needs of the Middle Tennesseans that are eligible for the service. As far as our specific job duties, and this be about where I wrap up and turn it over to Sarah, there's really 6 things that we're doing, thinking beyond the programs and the aim that those have to increase quality of life for older adults. I mean, what we're really doing as a regional council, serving in the role of area agency, is to establish goals and objectives and priorities for the dollar amounts that I just mentioned by program area. So there are broad goals that are established by national policy and federal laws, but it's up to our region to determine sort of in a more granular way what we're trying to accomplish with the program spending from the Older Americans Act. We also are responsible for procuring and coordinating the provider network that would be doing the direct services to older adults. And these are often for-profit companies or nonprofit organizations that are in the business of working directly with older adults across the range of services that I mentioned earlier. We are the gateway to information and assistance for older adults, their caregivers, and other consumers who are just interested in knowing what's out there and what they may qualify for. And to that end, this 4th bucket here is that we have a role in screening individuals for eligibility and determining the needs that need to be addressed through the programming. We then connect those individuals to the services and the provider network that we've helped procure and coordinate regionally. And then finally, from an accountability standpoint, we track the service delivery and we monitor the quality. And so those are really the 6 main tasks that we play in on a day-to-day basis to implement the OAA and the state funds for aging and disability services. What I'd like to do now is turn it over to Sarah Fowler, who manages all of this activity within GNRC, and she's going to introduce to you the program teams and share with you a little bit about their day-to-day in terms of delivering this programming. Sarah.
Thank you, Michael. Good afternoon, everybody. So Michael gave you a great overview of the funding we receive and the purpose for the funding. Now I want to explain a little bit more about how GNRC actually works to use the funding and introduce the teams that do that. So first, here's our information and assistance team led by Diane Schlafman. The INA department is our gateway or point of entry for older adults and their caregivers to access information about available programs and services. The staff answer the helpline and connect individuals to resources in the community based on their needs. It could be something as simple as needing a number for a transportation resource, or it could be something as complicated as a family not knowing what to do with providing care for their loved one and having to manage the whole home and community-based system. So answering the helpline, you never know what you're going to get, who will call that day, who the information assistance counselor is going to give hope to that day. Also under this department, we have our SHIP counselors. SHIP is the state health insurance program, and this department provides free, confidential, and non-biased information to Medicare beneficiaries, their representatives, and those who will soon be eligible for Medicare. And part of the information and assistance is doing the screenings for our programs. They determine eligibility for the various programs. And on to the Home and Community-Based Service Program, or HCBS, is led by Erlene Chenault. And these service coordinators conduct home visits with individuals to further assess the need and to coordinate services from GNRC's network of providers. Again, you never know quite what you're going to walk into when you schedule a home visit. And doing home visits, you learn that not everyone has the same standard of living as you might, or may not have the capacity to keep the same standard of living that they used to have. And so our programs want to help those people to stay in their home and to maintain their standard of living. Our Guardianship Program is led by Kim Hale. And that program, it receives state funds beyond the OAA programs. So the Public Guardianship Program provides services for individuals assigned to our agency by the circuit, chancery, and probate court system. These individuals are not able to safely make decisions for themselves, and they don't have family available to help them. So we are appointed by the court to help them to make those decisions, whether it's their finances, housing, or any life decisions, and sometimes they can even result in the end of life decisions that they have to make. Our quality assurance, or QA team, is led by Marilyn Wade, and our information systems team is led by Cynthia Balfour. These teams monitor quality and ensure compliance with state and federal standards among providers and information systems as they track program usage and service delivery. Our choices team is led by Fred Nahaj, and it's an important part of our aging team, but not directly associated with OAA or TCAT, our Commission on Aging and Disability. This team, Choices, works with TennCare to assist individuals who do not already have Medicaid to apply for choices or long-term care services. These long-term services can be provided in a nursing home or in an in-home setting. And our choices counselors assist those individuals or family members to navigate that pretty complicated application process. Through all of these programs that GNRC administers, we all try to understand that life does not always turn out how we plan it. But we as counselors try to help those individuals by empowering them to make informed decisions, by trying to stay active and healthy, by helping them to remain in their home as long as possible, and to try to ensure the rights of older adults and prevent elder abuse. This next graphic shows some of our highlights over the last year. This slide was part of our GNRC annual report, and you can see some of the different services we provide and how we track it. We were able to provide information and assistance to over 7,000 individuals, Medicare counseling to almost 13,000, individuals and over 455,000 meals. Some highlights that aren't on the slide include our elder rights initiatives, where we collaborated with our meal providers and some senior high-rises to disseminate over 3,300 fraud prevention placemats and information about reporting elder abuse. Our SHIP program has expanded outreach to include informational flyers about COVID-19 vaccine scams to prevent Medicare fraud. So while this year has been difficult with COVID-19 restrictions, we have tried to find ways to educate and connect with older adults. We are also really excited that we began working with 8 of our senior centers to begin a grocery delivery program. And so far, these centers have been able to distribute 451 boxes of groceries and household supplies to individuals in need. So for the upcoming year, some of our priorities: we want to continue to focus on increasing services with remaining funding made available through the CARES Act and supplemental appropriations. So we continue to get funding through COVID relief programs, and those mainly are focused on our nutrition programs. We also want to expand the work and to continue to provide groceries and household supplies to eligible adults. That has been a great program that we are very proud that we can continue to support. We also want to expand promotion of evidence-based programming to encourage healthy choices and prevent illnesses. While sometimes these programs may not seem very important, we feel that they really are. We want to encourage people on maintaining their mobility and their quality of life. We also want to expand outreach efforts, making use of our new outreach and advocacy coordinator, and upgrade website and communication tools to provide additional options for consumers to access information and assistance. We feel like we need to move forward to meet some of our younger demographic. And also we will be working on completing a major update, and I apologize for this error, but it is to our 4-year area plan. And so we want to also make you aware of some of our ongoing challenges. With COVID-19 and the safety protocols, social distancing has made it difficult to engage older adults, creating a barrier. With all of our programs, we haven't been doing home visits. It's all over the phone. Our guardianship clients haven't been able, or staff has not been able to make home visits. And so that really puts a barrier between how we know they're receiving the care that they need to. Congregate group meals are not being provided right now. Everything has been shifted to home delivered meals to make it more safe. So while we are so amazed by our nutrition providers and so proud of the work that they've done to make that shift, it has put a strain on transportation resources to shift all of that funding and all of that concentration to home and community base and put it on an infrastructure that we don't put money into the infrastructure. We're just adding more people and more meals. That has been a strain, but our nutrition partners are really stepping up and we're really proud of them. Another challenge is our providers of our in-home services, they're dwindling. It's a nationwide problem, but something that we are feeling very much here in the Gnrc area. It's leaving people on the waiting list. It's making it hard for us to open up services for them, not having providers that are able to staff the cases and provide care for our individuals. And then Gnrc provides a heavy subsidy to pay for the full cost of the public guardianship program. So while these are challenges, we here at Gnrc want to continue to strive to provide these needed services for those in our communities, and we're proud to be a part of that work. And now I'm going to pass it back over to you, Michael.
Thank you, Sarah. And I also want to just acknowledge, or have everybody acknowledge with me, the great job that Sarah did as Interim Director of Aging Disability Services over the last too many months. But earlier this year, we did make it official. We removed the interim designation and have fully invested in her to be our leader of the significant work that we do on this area. Speaking of significant work, now it's your turn to take the requested action. What we're asking you to do today is to endorse the annual update to the area plan, allocating more than $8 million in federal and state funding to services across the 13 county areas. The majority of this funding is going to be going out the door to the provider network. A little bit of that money will be retained by Gnrc, but most of that is still being used for direct services that we provide through information assistance programming that you heard Sarah talk about, as well as the service coordination, the quality assurance and monitoring, and the information systems work that goes into fulfilling all of the requirements of the Older Americans Act and the expectations from the Tennessee Commission on Aging and Disability. So with that, the last thing I suppose I should probably point out, something that's also very important, is that the area plan was developed in consultation with an aging advisory committee that works alongside our staff, representing each of the counties and various segments within the region. It's a standing committee that works alongside our staff to formulate the recommendations and the priorities that we include in the area plan, not only the 4-year horizon, but also these annual updates. I want to thank Sarah and her team and Kristen Scuderi, who on our staff is the primary point of contact and quarterback for that Aging Advisory Committee. So with that, Mayor Brown, I'll turn it back over to you for any discussion, questions y'all might have about the proposed update.
Thank you. We will move forward with seeking an endorsement. Before we do, I want to say thank you as well to Ms. Fowler. It's always interesting to have our focus taken back to all the aging and disability services provided through Gnrc. It's also nice to see the names and the faces who work in those services. But really in a state of awe to see all that has been accomplished, number of people that have been served, and appreciative of you all who have worked in that arena, especially in the past year with the challenges from COVID. So thank you, Ms. Fowler, and please thank your team. With that, I'd open the floor for discussion and or a motion to endorse the plan.
Madam Chairman, this is Mayor Kirkman. I'll make the motion to endorse the plan.
Second, Mayor Durrett.
We have a motion by Mayor Kirkman, a second by Mayor Durrett. Anyone wishing to discuss, ask questions, learn more? Seeing no hands raised, I'm going to go ahead and call for the vote. All those in favor of approving the annual update to the area plan for programs on aging and disability services, please say aye.
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 Opposed, please say no. Okay, the plan is officially endorsed. Moving now to informational items, and I am going to introduce Mr. Skipper again to talk about or give us all an update on the government affairs activities that are in process.
Thank you, Mayor Brown. Well, I think many of you have probably heard or participated in the Middle Tennessee Mayor's Caucus, but we do have a handful of new mayors to the regional council over the last couple of years. There's also a lot of activity that's coming out of this group, even this week, as it pertains to making sure that we stay on top of the necessary policy changes and legislative initiatives that we need to have in place to support the work that we do together as a region. A little bit of history here on the Mayor's Caucus, and then I'm going to ask Mayor Moore, who is the current chair of this group, to say a few words about the importance from his perspective. But I'd like to give you a little bit of history and talk about the purpose of the caucus. I think the goal of today's presentation is just make you aware of the coordination that is currently happening between the Mayor's Caucus, which serves as the government affairs arm of the regional council, and leadership within the governor's administration and the Tennessee General Assembly. Let you know what the priorities are that have surfaced to the top of the list in terms of the work that we do to coordinate on with the state government. And then ultimately answer any questions you have and encourage you to participate moving forward. But real quickly, the purpose of the caucus is really 4 things that really drives this group. One is to foster communication and coordination among the principal elected officials of cities and counties across Middle Tennessee. And what that means really is that, you'll all get together formally as part of boards or committees that you serve on. These boards and committees, including this board today, have a very specific purpose to conduct business according to specific programming responsibilities or contracts that you're overseeing. The role of the caucus is really to zoom out from that day-to-day work that you're doing to collaborate with each other, to give you the time to do some shared learning, to brainstorm potential solutions to the challenges that Middle Tennesseans are facing, that you are facing individually as local communities that might be shared with your neighbors, to ultimately come up with a set of strategies that you can then implement through your formal boards and committees, including the Greater Nashville Regional Council and its boards and committees, but it could be other external organizations and even your local legislative body that you end up wanting to act through to address the priorities that are discussed at the Mayor's Caucus. And so it is about fostering communication and coordination amongst these mayors, which sounds very similar to the regional council. The distinguishing factor here, though, is it's without consideration for budgets or contractual requirements. It's just really open forum for y'all to direct the conversation in any direction that you think is going to be fruitful for yourselves or Middle Tennesseans as a whole. Once you arrive at strategies through this process, another purpose of the caucus is to make sure that we're advocating for public policies that are going to be beneficial to you all at the local level, as well as the region as a whole, and that we're promoting a positive image of Middle Tennessee as a place to live, work, and play, and particularly making sure that we're linking up our goals for that positive image to the programming that's provided through government grants, whether we're talking about state or federal programs that Gnrc delivers, making sure that those are aligned with the true vision for that you have for the region as a high quality of life place. And then finally here, but certainly not least, is cultivating and maintaining strong and engaged civic culture and strengthening partnerships with the business community to ensure economic prosperity. At the Transportation Policy Board meeting, you heard Sean Falzer talk about the partnership that we have with the Nashville Area Chamber of Commerce and the development of an annual indicators report to bring attention to where we are seeing challenges with respect to the economic outlook or condition or capacity of infrastructure or social services that we need to make sure are in place at a high quality to continue the prosperity that we've seen in recent years. We've got other partnerships established between the Mayor's Caucus and the private sector to help support economic development planning, to make sure that public investments in infrastructure are indeed aligned with the way the private sector is investing in our communities. Not on the slide here, but extremely important in terms of partnerships is then the coordination with the governor's office, the commissioners of state agencies, and the leadership at the General Assembly. The caucus works to make sure that policies in the executive branch and then obviously laws that are passed by the state legislature are optimized to help you at the local level and us as a region do the things that we need to do to take care of Middle Tennesseans. The history here, the caucus has existed in name since 2009. It was really an idea that was borrowed from the Denver metropolitan area after a trip that Mayor Dean and a few other mayors took with the Nashville Area Chamber of Commerce. And particularly what we were looking at on that trip was how that region was able to accelerate support amongst the public and the business community for major investments in rapid transit. That region has invested at this point probably in excess of $10 billion in building out a regional transit system. And the question at the time was, how did they get that support in a place like Denver, which doesn't have the densities that we often find on the coast? And one of the answers to that question was, well, we had really good coordination and collaboration and trust among the mayoral leadership of the region, who were then the champions locally and with the state legislature to make sure that we can get this done. And so what we did is came back from that trip, and Mayor Dean asked the MPO at the time to expand a regionalism task force that it had created just 2 years prior into a full-fledged sort of mayor's caucus with open invitation to city and county mayors across a broad region. Early on, the conversations were largely focused on transportation, but very quickly we got into the 2010 flooding that we all remember and other issues that required coordination and collaboration among mayors. Real quick before I turn it over to Mayor Moore for his perspective is that the Middle Tennessee Mayor's Caucus now, as a result of the integration of the MPO program in 2017, is now a part of the organizational structure of the Regional Council. This is a chart that you've all seen multiple times and is available in the member guide on the website at gnrc.org/member guide. But what you see here is that the executive board, which is meeting here today, is acting on behalf of the members of the Regional Council, which meet annually. You all meet monthly at the executive board. We've got 2 policy boards within the organizational structure which have independent decision-making authority about the programming that they guide. The Transportation Policy Board that met earlier today is the top example of that on the chart. We also have a series of advisory committees that are formally part of the decision-making process of the policy boards and the executive board. A couple that you may know, the Aging Advisory Committee that I mentioned earlier is one of these. The Transportation Coordinating Committee that advises the Transportation Policy Board is another one of these. But maybe more importantly, we have a series of roundtables which are convening local experts, practitioners, or peers for the purposes of relationship building and brainstorming with the idea that you give them freedom to think big picture, you'll ultimately get to a place where you can direct the agency appropriately and make sure it's aligned with our vision. The Middle Tennessee Mayor's Caucus nests within our organizational structure as one of these roundtables that are convening specifically city and county mayors across Middle Tennessee. The representation today is about 70 mayors across 14 counties, so the 13 traditional GNRC counties plus Murray County, which participates in our transportation planning program. And together they represent a third of Tennessee's population, a figure that is likely to grow and share over the next couple of decades. And so as I bring up the next slide, I'd like to encourage Mayor Moore to come up on stage and give his perspective. Mayor Moore is the chair of the group. This is the second go around as chair. He leads a 13-member executive committee that meets on a more frequent basis. That group is supported with research and programming from GNRC staff, as well as a government affairs consultant, which is Stones River Group, and that's Mark Cate and Chris Gobble and Jeremy Harrell, Stephen Sassano, as you all might know. So with that, Mayor Moore, I'd like to turn it over to you before I wrap up with a look at our priorities this year.
Well, thank you, Michael, and what a great overview of the Mayor's Caucus and how it originated and also the work that we've been doing. And welcome to the new mayors that are on the call today. And I think we all look forward to that opportunity to see each other again and continue to create those relationships. In some of the earlier meetings, I heard Mayor Vogel talk about looking forward to that time to be able to look at each other and have those conversations, those sidebar comments with each other that are so important. And Mayor Reed, of course, mentioned that also, how important it is. You know, this past year has been a very difficult time because we've lacked those personal interactions and we've been relegated to having Zoom and WebExes and so on and so forth. And, you know, I look across my screen right now, the only person I'm seeing is me, and I see a bunch of little circles with initials. And we have to get back to that time when we can again have those great opportunities. The work of the caucus is so important for us to have those relationships with each other so that we feel like we can communicate with each other and talk about those issues that it's important for us to coordinate with each other on. You know, we can solve many of our local issues, but whenever we get to some of the larger issues, whether we're talking transportation, solid waste, whatever it may be, it's so much more important for all of us to be on the same page. I applaud the work of the Stones River Group. They've been great to work with. They've been very good to create a structure for us as far as understanding what's happening in the General Assembly. And yesterday, we had conversations with about a half a dozen of Governor Haslam's commissioners. And those conversations were one-on-one, and I thought there was some really good conversation and really questions probably that some of the mayors might not get answered as promptly or maybe as through a different protocol. You know, they were asking Commissioner Salyers, Commissioner Roth, and also Commissioner Ely and Judge Gibson and so on. Just those direct questions. And so that's why it's so important for us all to continue to work together. And I'm honored that I've been elected to lead this group and look forward to, again, today, we're going to be engaging with much of the leadership in the General Assembly, and again, having just some conversations and hearing their viewpoints. And also, they're going to be impressed when they hear that we represent over 2 million people. That's got a lot of clout. So we can't ever forget that if we're working together, we can accomplish a lot. So thanks for your leadership on this, Michael, and your staff that helps us also. So the other thing I might say is it's so important for us as a group to be working with our legislators money to certain programs, and we've seen that with a couple of the programs and it's created some challenges for us. But we need to be able to go there together and say, those funds are important for our communities. They're important for the region. They're important for the aging. So thanks for the opportunity, and I'll end right there.
Thank you, Mayor Moore. You do such a great job as chair, and I think you do such a great job because of your friendly disposition, but also your candor in the way that you can talk directly to these leaders. So I respect your efforts and appreciate your leadership, not only in the meetings yesterday and the meetings that we're about to have in the next 20 minutes actually with the legislature. But thanks for all you do. I'll leave, I'll end here with this slide on the screen. I'm not going to read these to you, but this is a look at the current year's priorities as developed through that Mayor's Caucus Executive Committee that Mayor Moore quarterbacks. These are derived from a lot of conversations that are had at the Executive Committee level, as well as across the full caucus. They also stem from an annual poll that we conduct among city and county mayors across the region each year. That poll is seeking to understand how mayors want to convene, what topics they want to brainstorm on, what challenges that they think they're facing, or what challenges they think are emerging for Middle Tennessee so we can get ahead of them. And then ultimately we whittle down to sort of the focal points for conversations with the governor's staff and the members of the General Assembly. And this year, you see 3 categories of priorities, about three items within each of these buckets, but we've got budget-related priorities, regional policy priorities, and then there's often a lot of consensus among mayors in Middle Tennessee to support statewide initiatives. And the governor's got some really good initiatives that we have our eye on this year with respect to mental health and criminal justice reform, as well as continued work on rural economic development. We're very supportive of any amount of money that can be invested into rural broadband to support the return of jobs to our rural communities. And so this is a list that doesn't stay static. The information that I've provided today, including these priorities, are available online at gnrc.org/Mayor's Caucus. There's a downloadable one-pager that describes the caucus, how you can get involved, and summarizes the key priorities for this year. With that, Mayor Brown, I'm going to turn it back over to you.
Now I'm going to be brief because I know there's some people that have been on this computer since 9:30 this morning and still have meetings to go beginning at 1 o'clock. I do want to say I'm so appreciative of the Mayor's Caucus, certainly appreciative of Mayor Moore's leadership. And I agree with what Mr. Skipper said about your personality and the way that you are able to speak with people. It's fun to, sit and talk to our leaders and see the light bulb come on when we are communicating concerns and issues with them, and you do such a wonderful job of that. And I appreciate all the other participation in that as well. Also want to say I appreciate all the participation with Gnrc. I think we're such an important organization in Middle Tennessee, although most people don't know it, but we really, really are. And so I know so many people have so many balls in the air right now, but thanks for sticking with us and doing the work so that we can all be better in our respective cities. We have lots of good things to look forward to, including seeing each other in person very, very soon, I hope. I believe with that, Mr. Skipper, I'll turn it back to you.
Thank you, Mayor Brown. I'll be respectful of time too. I know we're coming up to on 1 o'clock meetings, but I can't. I'm going to drop the slides and so I can look everybody in the eyes. I do want to say before we hop off today how proud I am of Gail Wilson and all that she's contributed to this organization the last, since I joined in 2016. I have to say she's been the most important person in my work life and was really the pivotal reason why I was able to acclimate after the before the integration, but through the integration process with the NPO, and what she has meant to the organization, and not just from a finance director position, but her legacy. I wonder what it'll be, whether it be, will we remember her for being finance director or for her leadership on the aging and disability issues? We'll let time tell, but I do, just on a personal note, want to say how thankful I am and how important she has been to me and other staff. And we are looking forward to seeing her do great things at the state. And I know she'll continue to be our advocate and the advocate for area agencies across Tennessee. So thank you, Gail, for everything that you've done for us. I'm sad that this will be the last time that we're signing off together at an executive board meeting, but here we are. So thank you.
Does that conclude your report, Mr. Skipper?
That is all I have to say.
Well, I will once again say thank you to Gail. You will be missed. You will be remembered so very well, and we are all grateful for the work that you have done with our organization. And like Michael said, you will do so well for the state as well. So thank you, thank you, thank you. And we expect to see you around. With that, I'll ask for any other business that anyone may have to come before this board. Check my participants list. You seeing anyone, Michael? I am not. With that, no one indicating they wish to speak, I will seek a motion to adjourn.
So moved by Ryle.
Thank you, Mayor Ryle. In a second. I think we can consider ourselves adjourned.
Second.
The end of. Thank you, Mayor Moore. Everyone have a great afternoon. We will see you later.
Thank you.
Thank you, Mayor Brown.
Thank you all.